Silver Chain Home Hospital really benefits my patients because they're able to be managed at in their own home.
Patients really enjoy being at home. They thrive at home. They're allowed in their own environment. They've got familiarity around them. They're allowed to sleep and they rest at the times that they want to sleep.
Silver Chain is able to provide the service within the hostel or within the nursing home environment, and so they don't have to be troubled by getting into an ambulance and going to accident emergency.
Occasionally patients have other commitments, so that if it's a young mother, she might have her children at home with her, so she doesn't have to worry about other people caring for those. And we also look after children from the age of 13 and adults up into their older age.
The benefits of the home hospital help with you've got all your friends around you. You've got the carers there that help you.
And they know, they have the confidence that they've got skilled nurses and doctors coming in to see them at home and that they're in a safe environment.
They have a significant number of protocols that are in place for the high standard management of patients at home.
The nurses within the home hospital team all come from an acute care environment, so we're all very skilled. We can provide care of a high level in the home, so we're not just doing dressings or just doing basic care. We're intravenous antibiotics, we're taking blood, we're giving intravenous infusions, we're caring for central lines, complex wounds, patients with pneumonia, patients who are unwell but not desperately unwell that they have to be in hospital, and they can be reassured that if they do become unwell, we're skilled enough to get them assessed and to take them into hospital should they need it.
Oh, the level of care is supreme. You couldn't get any better. It was probably better than hospital because they are responsible for everything they do, and they do the treatment thoroughly, because they can't come back in 10 minutes.
The level of home hospital care is first class. You get everything done for you. They've got all the equipment necessary, and it's first class care.
We have a link with a doctor all the time while we're out and about, and we also have a link with our colleagues if we've got any obstacles that we come across.
Well, I really regard the home hospital as my virtual hospital, and by that I mean that the service can provide hospital standard care for patients in their own home.
We run exactly the same as a hospital, so in my nursing practice we have a handover in the morning, very much like you would on a hospital ward. Our patients are allocated to us and then we go out and see our patients in the home. And we come back and hand over to the staff on the evening. It's exactly the same as a hospital environment.
Every 2 days or 3 days they would send a courier out with my medication, and then every morning the nurse would ring up half an hour before she'd get there and say, Mr. Orshot, this is Shirley or Jackie, and then we were there in 20 minutes, quarter of an hour, 20 minutes. And then I'd go there, they come in, they're very efficient, they come in, they've got their bag with everything they need, and within 10 minutes, 15 minutes, they're gone.
The Silver Chain Home Hospital has really made an important impact on congestion in hospitals. For each patient that is managed in their own home, that is one less patient that needs to go to hospital.
GPs have to make the decision at that time when they see their patient whether they feel that they're acutely unwell and have to go into hospital, or whether they feel that there is support in the community for them to be managed. And if they're unsure, they can ring Silver Chain and speak to a nurse directly. The liaison nurses are there 24 hours a day, and they will give them advice as yes, these patients are suitable to be cared for at home.
If I didn't get the home care, I would have to stay in hospital for 6 to 8 months. I couldn't believe it when the nurses told me that with this new Baxter method they use, and it's brilliant because every day in hospital would be, for that amount of time, would drive you nuts.
One of the big advantages of the home hospital is that with a little devotion of time in training, you can maintain your involvement in the management of your patient in association with Silver Chain, or at the very least Silver Chain Home Hospital keeps you as the GP in the loop.
Oh, they're lovely. I wish I was younger and had hair. And yes, they were very good. They were kind and gentle. They took all the Staples 8, which was over 30, and they never hurt me once, so I was quite happy with it.
It really benefits my patients. It's a service that's available 24/7 and provides in-home care for patients that would otherwise have to go to hospital.